When someone is considering getting an implant or a bridge, you probably would like to think about the long term of each option. Usually with the dental bridge, you put a crown on neighboring teeth and it's fake teeth in the middle that kind of cover the gap. The dental implant is great because you can replace the single tooth without having to account for the neighboring teeth. One of the benefits of implants is they can't decay, whereas a bridge, you'd go through the effort of getting that placed, you go through the effort of getting your teeth, adjusted to fit the bridge, and then you develop another cavity. That is a risk for people who are very cavity prone. Another benefit about the implant is that when you put it into the bone, you are stimulating that bone, you're continuing the growth and the use of that bone over time so that you're not losing bone as you age or as you have tooth is missing. With a bridge, you have nothing to stimulate the bone. Both are great options. Bridges are a little more traditional, but again, they do involve removing tooth structure, and that can be a concern for the longevity of the next door teeth. When we go through the treatment planning process, we're really looking at the whole patient and what they come in wanting. Once we kind of have that determined, we look at the gum health, we look at the bone density, the quality of the bone. We make a whole plan. Often when we're placing a dental implant, we don't want to just look at that one site. We want to make sure it's going to work with the rest of the patient's dentition and the rest of their teeth, and just make sure that we're placing it in a healthy, good site. For more information, give us a call here at White Smiles Family Dentistry. Come on into our office, and together we'll find a treatment option that will work best for you to get your mouth back to a healthy place.